Hey there, hi everyone. Thanks for joining us today on this Facebook Live broadcast right here at the Keeler campus of the Mobile County Health Department. We're here to just give you a couple of updates on sort of what we are planning to do as part of our response to COVID-19 outbreak across the world and in the United States. And so first I just want to announce that Family Health, the healthcare division of the Mobile County Health Department, is consolidating services and staff beginning first thing tomorrow morning. So these are where we'll be offering services. So effective March 18th, tomorrow morning, our urgent care at the Keeler Memorial Building here on North Bayou Street will be open Monday through Friday at 7:30 a.m. to 4:30 p.m. Again, that's 251 North Bayou Street in downtown Mobile. At this location, we're only evaluating people who are sick at the Keeler urgent care location, just to try to give folks who are sick a place to go so that we can safely move them in and out for evaluation. Our Newbern Health Center would be also open Monday through Friday from 7:30 to 4:30 p.m. This is at 248 Cox Street in Midtown Mobile. There we will see well babies, so patients 1 year old or younger, for well child visits, and WIC, Women and Children, Supplemental Nutrition Program participants will be seen at the Newbern Health Clinic. There will also be screening there to make sure that only healthy people are visiting the Newbern Health Clinic for those well child and WIC appointments. OB services will be offered at the Women's Center directly behind the Newbern Health Center Mondays and Wednesdays from 8 o'clock until 1 p.m. and Thursdays from 7:30 to 4:30 p.m. All other Mobile County Health Department clinic sites will be closed, and our staff will be reduced at those locations that are not remaining open. Also starting tomorrow at 8 o'clock, we're opening 2 additional information lines in addition to our COVID-19 info line. So that general information line is 251-410-MCHD, or that's 251-410-6243. In addition to that, for our Mobile County Health Department family health patients, we're opening up a medical triage line at 251-690-8978. That's 251-690-8978. In addition to that, we have a pharmacy refill line. Again, this is primarily for our patients, but that line is 251-445-8635, 251-445-8635 for pharmacy refills. Just a point of clarification, the medical triage line and the pharmacy refill line are primarily for the Mobile County Health Department existing patients. We know there are over than 40,000 patients around Mobile County that we're trying to make sure that we preserve access to important services like medicines for. The COVID information line is available to anyone who has questions. The question that we get the most is, where can I get tested? And that's still not an easy question to answer. There is still limited testing in Mobile County, despite national and statewide announcements that we have more and more testing available every day. Testing is still limited in Mobile County, and because of that, we generally are hearing around town that only the sickest patients are being tested are those that are at greatest risk. So people that we know have traveled to other areas with ongoing community widespread transmission, or folks who are severely ill requiring hospitalization that have no other explanation for their illness. Now, Mobile County Health Department at this time is not testing for coronavirus. We're not pulling specimens. We don't have the capacity to pull specimens for the general population and send them in for testing. We're still trying to work towards that with our commercial lab partners and also through the state public health lab. But as you're hearing nationally, the specimen collection materials are in short supply globally. The health department has heard, just like all of you have heard, that there is testing going on around the community, but the health department does not maintain a list of testing facilities in Mobile County. So where we hear testing may be happening at this hospital or that hospital or this clinic, we are not able to let folks know where they might be able to find testing around the county. What we want to discourage is doctor shopping for testing. If you have a fever and a cough or shortness of breath and you have no risk factors for coronavirus infection, or if you have a mild illness that can be managed at home, we want you to stay at home until you are well, and that means that you're without fever for 72 days or 72 days, my goodness, until you're without a fever for 72 hours or 3 days. So again, if you have symptoms of fever, shortness of breath, or cough, if you can manage that, that illness at home, taking plenty of fluids, taking your over-the-counter medications, please stay at home and don't go around in the community until you are without fever for 3 days. We just want to keep these limited supplies that we have at urgent care centers and emergency departments available to the folks that need them most. A couple other announcements. The Mobile County Health Department had previously announced rabies vaccination clinics throughout the county on Saturdays in March. Those will be postponed. We will reschedule those in April if we're able to, and we'll announce those dates at a later time. And so some other things that I just maybe want to address. We get a lot of questions about sort of, we've heard what's going on in the northern part of our state, and should we be following some of the same guidance? So you may be aware that Jefferson County is experiencing a large number of cases. Let me just report on the number of cases. So we still have no cases in Mobile County. This was effective 10/15 this morning, and this will be updated again generally after 4 o'clock in the afternoon. So at 10:15, the State Department of Health was reporting 36 confirmed cases in the following counties: Baldwin, Elmore, Lee, Jefferson, Limestone, Madison, Montgomery, Shelby, St. Clair, and Tuscaloosa. So of those 36 cases, by far the most cases have been reported by Jefferson County, and that's 20 cases. So this is quite an alarming sort of acceleration. So last Friday, I spoke to many of you. We had our first confirmed case in the state of Alabama announced. That was just 4 full, almost 5 days ago now. And now statewide, we're at 36 cases. And Jefferson has gone from 0 to 20 cases in just that short time. So this is very concerning. And because of that, the governor and the state health officer have issued a state health order for Jefferson County and the surrounding counties. I've not seen the health order, but just to paraphrase what that implies is that they are prohibiting mass gatherings of 25 or more people. They are closing senior centers and encouraging senior centers that provided things like meals for seniors during the day to find other ways to get those meals delivered to their clients. They're closing all private and public schools and all child care or daycare facilities that have more than 12 children. They're saying that no one should be allowed to visit long-term care facilities and nursing homes, except that those folks that are providing, compassionate care and other vital health care resources to those facilities. And then I think probably the one that's causing the greatest stir is for the next week, they're ordering no on-site consumption of food or drinks in restaurants and bars. So these are really austere measures, and the governor, in consultation with the health officer and her coronavirus task force, believe that these measures are necessary to try to slow down the community spread of coronavirus in Jefferson County. In Mobile County, we still have 0 cases, but everyone should be preparing their school, business, daycare, nursing home, household for the possibility of having to, being confined at home for a period of 2 or 3 weeks, or having to care for children or, elderly family members that should be staying at home, and limiting, their movement about the community. So as soon as we find out that we have a confirmed case in Mobile County, we will let you know. And then we will be working with our local leaders to determine if additional community mitigation measures are needed to slow the spread of coronavirus in our community. So with that, I will answer a couple of questions. And James, if you see questions coming in on Facebook Live, just let us know.
My news director wants to know, is Providence Hospital building any kind of portable hospital in the back? Apparently there's been some alleged back there. You know anything about that?
I do not know anything more than you probably know. We have heard that hospitals are beginning to triage patients outside of their normal sort of intakes, and this is a process or a measure that is something that has been planned for some time during traditional pandemic planning. I've not heard about any construction of new facilities, brick and mortar types of things, but it would be perfectly reasonable for healthcare centers to triage patients outside of their traditional waiting room. In fact, Mobile County Health Department at their Keeler location, at our Keeler location here, will be doing something similar starting tomorrow at 8 o'clock, where we will be screening people outside of the building so that we can permit controlled entry of people who are sick into our facility that need to be evaluated, and avoid exposing healthcare workers that need to stay healthy, or avoid, having an outbreak in our healthcare facility, which would shut down services that are essential to our community.
When do you guys think you're going to get any tests? Because I think a lot of people are concerned from my TV station that there's not any confirmed cases in Mobile because we're not offering testing here. So when do you think that tests will be available in Mobile?
Yeah.
Because in Birmingham they have the drive-through and all that kind of stuff.
Right, so the Birmingham laboratory that I've seen in the news that opened a drive-through laboratory, I think what's novel about that is the laboratory opened that location and they're the ones doing the testing, and so that is like a dream situation where you have a laboratory that has stepped forward to conduct that testing, in their parking lot for their community. That we know of, we don't have anything like that in Mobile County right now, certainly not a laboratory that's stepping up to conduct testing. We've been told by some of our state colleagues that and part of this plan has already been rolled out. The state Alabama Hospital Association, working with the governor's task force and our health officer, Dr. Scott Harris, have been planning for regionalized testing rollout. So there are 20 to 23 testing sites I have heard throughout the state that will be coming online this week that will be designated as locations that will be prioritized for receiving kits from the state health department. We've heard there are about 14, 15, maybe as many as 1,700 test kits that will go to those 20 to 23 locations. But you can do the math on that. That's still not a lot of test kits per location. And they're also trying to distribute them so that where there are not large hospitals available to participate in this voluntary program, they are using health departments who will have a small number of test kits. It's really tricky. We are trying to work with our commercial laboratory partners to get more testing materials, but as I've mentioned, there's a global shortage of the transport media, of some of the reagents that are needed to extract genomic material from the swabs. So we've asked for assets from Strategic National Stockpile, from ADPH, but as you can imagine, nationally, a lot of the national assets are probably still going to the right places in Washington, California, and New York. So I'm sorry, I don't have a good answer for when we expect to have more testing available.
Does the county and the city declaring either states of emergency or public health emergencies, does that help y'all any, or is that really just for city and county response?
The declaration of a public health emergency probably a month or more ago freed up some policy changes and paved the way, so that helped. Then the federal declaration of a federal emergency helps money flow more quickly, but it doesn't open a bank account that we can go get money out of. So yes, those declarations definitely help us be more nimble in our response. We heard yesterday from the Centers for Disease Control that notices of award for federal assistance may be going to states. as soon as this week, that some of the heavily impacted jurisdictions may have gotten notices of their award yesterday where they could start immediate spending. I've not heard that that's happened in Alabama. And then once the money comes to Alabama, then the pass-through mechanism to Mobile County has to be worked out. So still there's a little bit of delay, but the federal government and the state government is working in an unprecedented fashion to move very quickly to get funds and flexibility in line. I heard just yesterday that, or maybe today, sorry, it's already a short week, that the Alabama Board of Pharmacy has relaxed the restrictions on requiring prior authorization for refills, so that people who need an additional 30 days of prescriptions will be able to get them without a prior physician approval in some situations. So again, those are the kinds of things that we start to see ease up a little bit with these public health and national declarations. Mark?
We had a viewer ask if you could repeat the advisory for those Birmingham restaurants about, the limitations.
So again, I'm paraphrasing because I don't have the exact health order in front of me, and as soon as we get it,
It was for Birmingham.
we'll post it on our website. But for Jefferson County and the surrounding area, effective today or tomorrow, prohibition on mass gatherings of more than 25 people, closure of senior community centers, a closing of all private schools and child or daycares with more than 12 children. Of course, public schools have already been notified that they should close by the end of day tomorrow. No visitation to nursing homes and long-term care facilities, and then no on-site consumption of food or drink for the next week in bars and restaurants and fast food facilities. So it's drive-through, takeout only.
Okay. Since there's like no testing in Mobile County as of yet, that we don't have the test or anything, should we just assume that the virus is already here?
So we have had some testing in Mobile County. We know, we've heard of, several dozen patients that have been tested in Mobile County by other providers and hospitals. The difficult part of knowing about testing is that negative test results are not reportable to the state health department or to the Mobile County Health Department. So we just have no way of knowing how many people are being tested. But we do know there's testing going on. But yes, it is likely that we have, some transmission or some, Mobile County residents that have been exposed, potentially infected with, the virus that causes COVID-19. I think to think that we don't is probably very naive at this point, since on all of our borders and now across our state we're seeing cases popped up. So we do anticipate to see a case any day now.
How do you feel about the Mobile restaurants being open?
I feel okay about it right now, but everyone should practice social distancing, but particularly if you're in those highest risk categories. If you're 60, 65 or older, if you have underlying medical conditions, you probably should not be going out to eat and sitting within 6 feet of another table of other people eating. You should be staying home at this point and protecting yourself and your family. For people who are young and healthy, we're really recommending that you just sort of stay abreast of what's going on in the community. And if you're out, try to practice social distancing, and that means being 6 feet or more away from people. Try to remove yourself from an area where people are sick, maybe coughing. Wash your hands thoroughly. Disinfect surfaces. Stay at home if you're sick. Those kinds of things. I don't think we're ready yet to say don't eat out, in bars and restaurants in Mobile, but it's, the message is stay, closely, in touch with what the local authorities are recommending, and also sort of adhere to those social distancing and hand and cough hygiene recommendations. And certainly if you're in a high risk group for, complications or severe illness, if you were to get infected, stay at home. Anything else?
I'm good. Thank you.
Okay, thank you. We are committed to doing, a quick Facebook Live at 2:30 each day, particularly over the next couple of days, not on the weekend, but probably start back up next week, because things are changing so quickly. We want to provide the most up-to-date information, and doing it in this forum sort of helps us get the message out to as many people as we can at once. So join us again tomorrow at 2:30.